Hello, everyone. This is Pangkong Fox, the Science Engagement Director for the CACNA1A Foundation. And I want to welcome all of you to the first of hopefully many more videos that will be coming your way, where I will just be taking up a few moments of your time to give you these sort of casual and informal updates on what the CACNA1A Foundation is doing on the science and research side of things. Back at the end of September, if you remember, the CACNA1A Foundation held its very first CACNA1A Research Roundtable in New York City. And this was just an amazing experience and just a humbling experience to have so many different brilliant researchers and clinicians from both academia and industry coming together for the first time to think about how we can move the science forward and get treatments into the clinical trial pipeline. So if you are interested in getting more details about what was discussed there, we do have a summary that is posted on our website, cacna1a.org, under our blog post. So feel free to check that out. But one of the most important things that came out of this research roundtable was a sort of a better, deeper focus and understanding of what our strategic research plan needs to be. What do we as a foundation need to do to really make these treatments happen? And this is going to take a lot of work. It's going to take a lot of time and money, but it's also going to require this continued collaboration between the foundation, the research network, and most importantly, all of you wonderful, amazing, resilient CACNA1A families out there. So we definitely can't do it without you. Especially since, there's such a large spectrum of the neurological symptoms that are seen within the CACNA1 community, and there's a large number of variants that have been reported. So we know full well that we need multiple shots on goal here. We need to spread our resources out among parallel projects to help as much of our community as we can. So in the last 2 months, we at the foundation have had many meetings with different researchers, other rare disease organizations that are on the same pathways we are, as well as biotech companies that are either looking to invest in a rare disease or offer services or collaborations to fill some of the research gaps. So I just want to highlight a few of these things that have come up in the last few months. So, first of all, we are planning on carrying out a smaller drug repurposing screen where we will be testing known inhibitors of other calcium ion channels on CAF 2.1, which is our calcium ion channel. This is sort of a shortcut route, but it's going to give us an answer sooner than later of whether this is a good pathway to take for our gain of function variants. And there are options of how, if we need to expand it to get more inhibitors. We're also looking at ASOs to inhibit or bring back the levels of CACNA1A expression to normal. So these are two types of modalities or methods of treatments that we're looking into for a gain of function variants. And so one thing that we really need are people or companies that can help us carry out these projects. So we actually just had a really great meeting with NCATS, and NCATS is the National Center for Advancing Translational Sciences, and it is part of NIH, or the National Institutes of Health. And NIH has some of the top scientists in the country as well as the world and experts in every field of science that you can think of. So there were probably at least 15 people from NCATS there on the call. There were neurobiologists, there were computational biologists, experts in drug discovery and repurposing, assay development, RNA therapies. I mean, everything that we're looking for. So it was just humbling to see how many people there were interested in learning about CACNA1A and the foundation. So we got really positive feedback from them, and a really engaging discussion after our presentation. So we're really happy with how that meeting went, and we are hoping to hear back from NCATS at some point to see what a collaboration with them might look like. Another highlight is that we've been learning about the use of ASOs for loss of function variants. And this is actually a really big deal because ASOs have traditionally been used to silence a gene or inhibit expression of a gene. And so it's always been used to target loss of function variants. I mean, it's just easier at a molecular level to turn a gene off or inhibit it versus trying to activate it. So we weren't sure if ASOs were going to be something that we could use for loss of function variants. However, we have spoken to a few researchers who are discovering ways to increase gene expression using ASOs. So this is actually a good step for going forward for what we would like to do, because it means that we may be able to pursue both a loss of function and gain of function treatment option at the same time. We've also spoken to some researchers who are looking at trying to keep working copies of CACNA1A around longer in the cell to compensate for the loss of activity that we see in these loss of function backgrounds. We also spoke to another lab that's harnessing CRISPR technology in a new way to increase expression levels of target genes. So, again, this is all really exciting because we hadn't been aware of these approaches for loss of function variants, and we're hoping that we can start some collaborations on that end. And then finally, we actually met someone who's working on developing vectors or delivery systems to actually package up the entire CACNA1A gene and safely transport it across the blood brain barrier for potential gene replacement therapy. So we were really thrilled to hear that somebody is actually working on this, since we have been told time after time again that CACNA1A is just such a monster of a gene. It's not going to fit in any of the traditional or the currently used vectors for gene therapy. So again, just super excited that this technology and all this technology, in fact, is moving in the direction that we want it to. However, time is always a big limiting factor here. So this all will take time. Um, Years, in fact, for some of these modalities to get to the point where they can enter the clinical trial pipeline. But we at the foundation are definitely, we're doing our part to try to accelerate this process as much as we can. So nothing is official at this point. There's still a lot of discussions going on with all of these researchers and with NCATs, but we will definitely keep you posted on what or how things progress. So, next up, I'm actually heading to a few conferences the week after Thanksgiving. I will be attending the genetics workshop for epilepsy at St. Jude Children's Hospital in Memphis. And then after that, I'll be heading to Nashville to attend the SYNGAP Research Fund's Scientific and Family Conference. So, this is another rare neurodevelopmental disease foundation that has had a really high level of success with driving their research forward. They also share many overlapping symptoms with CACNA1A related disorders. So I'm really excited to meet Mike and the rest of the team down there, meet some of these SYNGAP families, and see what type of science and research that they're doing, in hopes that we can learn some of the ways that we can reach that same level of success. Here at the foundation. And then I'll be meeting up with Sunitha and Lisa at the American Epilepsy Society's annual conference, also being held in Nashville. So that is what's coming up for me in the next week or two. And I'm excited to tell you about my travels when I get back. So look for another update next month, and I'll see you in December.